Hello class, my name is Chris and my topic today is MDMA. MDMA is a synthetic drug that acts as a stimulant and a hallucinogen. It is a type of empathogen which increases the individual's feelings for empathy and compassion towards others. Some slang terms for MDMA is ecstasy, E, X, pills, and Molly. It is currently classified as a Schedule I drug, which means that it has the highest potential for abuse and no medical benefits, which is currently being disputed by many researchers. It is primarily taken orally, but is possible to be smoked or snorted. It is a very popular party or rave type of drug since it makes users want to dance. Some history of MDMA. It originally was developed by a German pharmaceutical company in 1912. Its original intention was to act as a parent compound to synthesize medications that control bleeding. In the early 1980s, psychiatrists started using MDMA in clinical trials without receiving approval from the FDA. Psychiatrists believed MDMA could be used for psychotherapy since it allows their patients to open up to them. And at this time, MDMA became widely available. And then in 1985, the DEA declared an emergency ban on MDMA and then classified it as a Schedule I drug. So how MDMA works? MDMA impacts the brain primarily through releasing the neurotransmitter serotonin and norepinephrine. A typical dose is about 80 to 105 milligrams, even though most people report taking a second dose when doing MDMA. On average, the user starts to feel the effects after 45 minutes, and the effects can last from 3 to 6 hours. Some psychological effects: it enhances the sense of well-being, increases extroversion, increases emotional warmth and empathy. It increases willingness to discuss emotionally charged emotions with others. It increases sensory perception, which is what MDMA is known for. Its hallucinogenic effects increase the sense of touch and hearing. Some physical effects include increased energy. Some people experience nausea. It causes your pupils to dilate, increases sensitivity to light, increases heart rate, causes your jaw to clench, increases body temperature, sweating, and lack of appetite. Coming down from MDMA causes an inability to sleep and people feeling exhausted. They feel anxiety, irritability, and depression, and some may even feel paranoia, and they have difficulty concentrating the next day. So ecstasy is the term for MDMA when it's in a tablet or capsule form. Ecstasy tablets have been found to be containing other drugs, including meth, caffeine, heroin, cough medicines, methadone, which is part of bath salt, and cocaine. These combinations can be very deadly. Molly is slurm for the molecular form of MDMA. It is usually sold as a white powder in capsules. It is mistakenly believed that Molly is a pure form of MDMA, but the DEA has analyzed Molly, and the majority of Molly available is mixed with other drugs, just like ecstasy, and a large proportion do not even contain any MDMA. Some risks of taking MDMA include high blood pressure, fainting, vomiting, impaired memory, heat stroke, panic attacks, and seizures. And then long-term use of MDMA may cause depression, a dependence on MDMA, memory and concentration problems, liver problems, and kidney failure. So some consequences of MDMA. Overdosing on MDMA is very rare, but taking high amounts can still be very deadly. MDMA prevents the body from regulating temperature, which can cause hyperthermia from dancing and the outside environment. It also causes people to feel dehydrated, which causes them to drink more fluids, but actually MDMA retains these fluids, which can increase the problem of an electrolyte imbalance and brain swelling. Other consequences include MDMA interferes with the perception of motion, which can be very dangerous if someone tries to drive. The interaction of MDMA with other drugs can also be very dangerous. And multiple studies have shown that MDMA is associated with risky sexual behavior. This includes having multiple sex partners and higher rates of unprotected sex. Thank you for listening to the presentation.